Hi, you guys. Welcome back for our daily practice questions. It is day 215 and our Pharm series continues. But as always, I like to first start with my introduction and disclaimer before getting started with our questions for today. So, for those of you who are familiar with me, hey y'all. For those of you who are new here, welcome, welcome, welcome. I am Dr. Brittany Weinstock, a family nurse practitioner and the founder and CEO of the Nursing Studio. I provide resources, tools, review courses, review videos, review books, digital flashcards, Q banks, one on one sessions, and more to assist nurses as well as nurse practitioners with success on their boards as well as in practice. I've been doing this since 2015, assisting nurses and nurse practitioners internationally with exam success. But y'all know my disclaimer and reminder is that we know there's no absolutes in medicine. We treat on a patient by patient basis, and any of the questions that you see here, I have designed and created based on the current guidelines that are being tested on the ANCC as well as AANP exam. Now, any of my videos where I'm teaching on things that we currently do in practice, I will always say that so there's no confusion. So, with that being said, let's get into question number one for today. But before we get started, don't forget to hit the subscribe button so you're not missing any of my videos. And if you would like to gain access to my MP Test Success Toolkit, it is free and linked in the description. Also, my website is linked in the description and it houses all the resources that I offer. If you are looking to join my upcoming 5-week review, today is the last day to enroll and I have one space available. Class starts August the 11th and runs through September 12th. For everyone who has already enrolled, be on the lookout for all the upcoming emails this week. All right, you guys, question number one. A 7-year-old child presents with chronic, itchy, dry patches on the flexor surface of the elbows and knees. There is no sign of secondary infection. What is the most appropriate initial treatment? Is it A, oral antihistamines? Is it B, topical corticosteroids and emollients? Is it C, oral corticosteroids? Or is it D, topical antifungals? Take a moment and tell me what you got in the comments, you guys. All right, I always recommend reading the stem of the question first, as it allows you to slow down to ensure you're answering what is even being asked of you. Here, the stem of the question states, what is the most appropriate initial treatment? And y'all know I always say, if we're talking treatment, you need to run it back and see if they provided you with a diagnosis. And if they have not, then you got to run it back a step further and look at the assessment findings so that you can determine what it is to be able to treat it, right? So since there's no diagnosis provided here, let's look at these assessment findings. So we have a 7-year-old child has chronic itchy dry patches on the flexor surface of the elbows and knees. Y'all, this is classic presentation for atopic dermatitis, aka eczema, right? So it's asking for the initial treatment. So your best answer is B, your topical corticosteroids and emollients. All right, question number two. A 19-year-old female presents with a few open and closed comedones and occasional papules on her forehead and cheeks. What is the first line treatment? Is it A, oral doxycycline? Is it B, isoretinoin? Is it C, topical retinoin? Or is it D, oral contraceptive pills? Take a moment and tell me what you got, you guys. All right, stem of the question, what is the first line treatment? So again, you're going to run it back and look and see if there's a diagnosis provided. I don't see a diagnosis, so let's run it back and look at these assessment findings. So we have a female that's 19 that has open and closed comedones and occasional papules. So this is a mild case of acne. So remember, with mild cases, C is your best answer. We'll start with those topical retinoids. We go more into the antibiotics and things of that nature when it's more the moderate severe stages. And then lastly, question number three, a 30-year-old male presents with a circular scaly erythematous lesion on his trunk with central clearing. KOH prep confirms a dermatophyte infection. What is the preferred treatment? Is it A, topical hydrocortisone, B, topical antifungal, C, oral fluconazole, or is it D, oral prednisone? Take a moment and tell me what you got, y'all. So stem the question here, what is the preferred treatment? So again, you're going to run it back and look and see what's provided. No diagnosis here. So looking at the assessment findings, we have a 30-year-old male with a circular scaly erythematous lesion on his trunk with central clearing. Y'all, classic presentation of tinea corporis, which is AKA ringworm. So we want to go with topical antifungals, right? Topical and not oral, topical antifungal. So B is your best answer. All right, you guys, I hope you found this helpful. As always, Be sure to like, comment, subscribe, and share with whoever you may think may find this beneficial as well. But y'all know what to do. Y'all make sure y'all meet me back here. And if you need any of the resources that I do offer, feel free to reach out to the nursing studio. You can give us a call. You can shoot us a text message to this number, or you can shoot us an email to the nursing studio, the number one at gmail.com. Everything that I offer is linked to the bio of this channel, including my website. And as I mentioned previously in the video, my website is also linked in the description of this video, and it houses all of the resources that I offer. All right, y'all. Y'all know what to do. Y'all make sure you meet me back here. Happy studying. Bye, y'all.